Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about news and trends impacting the industry today. My name is Justine Gincola. I'm on the corporate communications team at Inovalon, and joining me today is Patrick Kovalik, Industry Principal, Healthcare and Life Sciences at Snowflake. And if you've been following our podcast series, you'll remember Patrick from a recent episode. As always, great to sit down with you, Patrick.
Hi, Justine. Thanks for having me back. It's great to be back. Always glad to talk healthcare and data and outcomes, and looking forward to it. Thank you.
Absolutely. So today we're going to continue our conversation from last time, kind of around the impact of data and technology. So Patrick, I will let you give a quick recap of our last conversation.
Yeah, sure. I think where you guided us last time was we were just talking about, sort of the mess and the chaos and the inconsistency of data in healthcare, which is a reality. So the more you can understand that and believe it, you're better prepared for the future. So we were talking about how, organizations today just can't operate in silos, whether that's internal or even external, just only going it alone with your company, or going in a silo of IT does this and business does this. That's the shift that really healthcare has exploded on in the last number of years, is how do you collaborate? Because there is no perfect data set, there is no perfect source, there is no perfect answer for any given situation. And at the core of it is data. That was, if I recall, that was our theme, was just how foundational data is to have good analytics that can drive business outcomes. And that's what's at the core of both Inovalon and Snowflake, is to be able to say, hey, we are ready for the data in whatever type, format, speed it comes, so we can get a good answer. So I think that's where we left it, and let's get deeper on a few other stories.
Yeah, absolutely. And one thing you had mentioned in our last conversation was that even healthcare data specifically is so vast. So before we kind of get into that storytelling, can you tell me what are the data types that we're looking at in healthcare, and why does that type of data matter?
Sure, yeah, and thank you for asking, because sometimes I even take it for granted. When you live in this space all the time, the world of data sometimes is so, on the payer side, it's like, hey, I live with a claim, I live with a prior auth, an eligibility file, and if I'm a provider, I live with an electronic medical record or a clinical note. And that's the shift of, the world is not perfect to, I have one just data source that I can lean on. That's where the innovators in the market are going, is they're embracing all kinds. And at the core of it, or probably, one of the sexiest areas, is this concept we call unstructured data. And to be candid, it's, there are stats out there, but it's been said to take up almost 80% of all healthcare data is unstructured. And what that means, to the person who's new to this, or, even scared or intimidated by it, it's, structured data is what's in your BI reports, what's in typically rows and columns. Like if you think of an Excel spreadsheet or a database, it's easy to get to, it's relational. Unstructured data is DICOM images and PDFs and other images and notes, audio files, video files, the podcast that we're doing here. The excitement of it is that lines up so perfectly for why AI has exploded, is because you now have technical capabilities that even business people like you and me can get to insights that are buried in all that unstructured, and make it usable, make it structured, so you can join it with the hard metrics that you have to get better insights. So that's probably the most exciting part of, like, hey, what does the world of collaboration and data get into? Of you can see organizations finally getting excited about, wow, I can really do that with their unstructured data.
And I think that's a great lead into this next question of having access to this data is kind of the step one, but then you've structured or unstructured, you have it. What is the industry doing with it that's giving it real meaning?
So it's triggered a number of light bulbs, and it gets exciting because at the end, the unstructured data helps you address the problem, which is what we're talking about. And one example I have is there's a customer I was working with, and they had the word Pizza Hut coming up over and over again in their call center logs. And you're just like, what in the world does a Pizza Hut have to do with getting an appointment or calling a physician group? Well, in the end, they, to find the location of this office, everyone always said, hey, find the Pizza Hut, turn left, we're behind there. And guess what? That Pizza Hut shut down. And so their anchor of how to find that location had disappeared. So buried at the core of all these calls and these frustrations of trying to get an appointment was just, maybe it's a bad address, or maybe unclear directions on how to get there. And it took them dozens of calls to figure out, hey, the problem here was that a Pizza Hut was being used as a location for a clinical need. And it's just a good example of like what's buried in unstructured data that you don't think about. And so how do you pull that out? How do you make it usable? How do you have it address the problem? And that problem was, why were all these missed appointments there? Why were, patients or members getting frustrated because they couldn't find it?
That is quite the example, Patrick. Very cool. And definitely, hearing the phrase Pizza Hut, not what you'd think in the world of healthcare and data like we're talking about today. But any other real world examples similar to that you could tell us about?
Yeah, of course. Thanks. And again, I like that example too, because again, it was so off the radar or off the traditional norms that it does just that. All of a sudden you start to think about what else is buried in there. And that is what I love about AI and LLMs and machine learning and all these technical buzzwords that come up is what can you do to a user to say, I could do that with my data? And some of it, and again, in the nature of AI, a lot of the clinical outcomes get a lot of the focus. I come from an operational background, so that's where I go after is how can I be more efficient? How can I help curate more of that story? And so when you think about just the world, I already hit on kind of PDFs and contracts. They're so big. Two of the kind of themes I have in my life that I'm helping some of my payer friends, my provider friends is, if you're still using Control F to find an answer in a massive document, there's a better mousetrap today. I, as a business user, can act like a data scientist and interrogate a document that's hundreds of pages long to say, hey, what's the contract date here, or what's the fee schedule, or is this service carved in? In years ago, I used to have to go to a specialty person in a team and ask them the question, and they'd read that document and they'd get back to me in anywhere from hours to even weeks. Now I can query that data and I can teach a model that makes it become more efficient. Similar to even, word clouds were so sexy decades ago of I do a CAP survey or I do an employee survey or I just do feedback from a conference that I'm at. Hey, what'd you like? What didn't you like? And you get these buzzwords of what were the themes. Buzzwords are great, but the meat of it is in the context around it to figure out, hey, you may have logged, you may have scored a CAP survey, 4s across the board, but the 2 pages of notes or the paragraphs that say, hey, this is really what frustrates me about my care or about accessing my physicians or about, your claim turnaround times, that's where that meat is there. And it's still available. You can still read them one at a time, but that's what an LLM and AI and having enterprise data strategies can pull together so you can look at a big picture and have those beacons, those light bulbs that say, hey, here's where you need to focus organization A, instead of just pulling them up one at a time and getting that. And that's the concept of AI. It thrives on sentiment analysis. It thrives on taking subjectivity out and remaining objective. I may have an influence on if Justine calls me every Friday, I kind of know what she's going to expect. And do I like that? Do I hate that? That's what I like about some of the data normalization and AI is it can look at the big picture data to say, hey, what are those new beacons? Where are those new light bulbs? And things like that, when you get into a physician note, from an EMR file that goes to a payer, or you get into a contract, or I get into a survey data, that is where both sides have the opportunity to win and to benefit. Because I can then, we talked about that last time, is the longitudinal history of Justine is incredibly valuable, but the clinical depth of, hey, how far from center was your A1C on that admission, or your injury that required the surgery, that's where both sides can fully benefit, and not just looking at them patient by patient, member by member. You can go big picture against all the data that comes in. That is where that's where it's proving to be most beneficial. And at its core too, same thing with value-based care. This is what also is helping AI thrive, is to be efficient, but to also have value be the outcome, not the terminology in a contract. If I can actually see where where my populations and where my member attributions have a need, I can raise that up. I can bubble that up, and that's what AI is doing across the whole healthcare market.
And Patrick, if we can just take that even one step further, and we've said this last time, and I feel like I'm starting to say it in a lot of these conversations we're having on INOvators, is we talk a lot about technology and data and carrying it over to the actual member, the patient, the person who is at the end of all of this is so important. Do you have an example or a story that is really specific to that patient outcome?
And thank you, because at the center, at the beginning, and at the start is the human, and you're always good at that of reminding that's why we do it. That's what data gives you the opportunity on. A couple accounts that we're working with is, as you look at AI, there was, heck, I can even speak from the heart. I lived this. I got an alert that said, hey, a prescription that I take regularly the inventory was impacted, so it could be fulfilled. And I smiled because, awesome, I got this alert, I got this text. It said, hey, this can't be filled. But I got no insight as to what do I do next? Who do I turn to? Where do I go find it? And I was kind of left holding the bag. And I smiled because the process was like, wow, we just leveraged big data, AI, to say, hey, we found a problem, and we alerted him in time. But I didn't know what to do next. Versus, fast forward both to the solutions that I'm helping organizations with, but also I'll speak from the heart. I had a specialty visit, and I needed to get a different prescription refilled. And we scheduled the appointment. It was great. It was 35 minutes away. And they came back to me and they said, hey, I noticed in your profile you've had telemed or telehealth before. Would you like to do that again? If you don't have any new real big issues, the goal here is just to make sure you're on track and get this fulfilled. And I just said, phenomenal. That would be great. So now I can have a 5-minute appointment that addresses the problem and I'm fulfilled. And at the core of the outcome of AI driving both of those, just look at my patient satisfaction in the second scenario versus the first one. I was littered with confusion and misdirection and, who do I point to next? So, just that is the goal of what any of these organizations are trying to do with their data, structured, unstructured, whatnot, is have the human experience at the center. And the second one, I'm fully engaged. Whatever my doctor now wants to say, I'm on board because I loved that flex. I love that they saw, hey, you had a success with this. Can we continue it? And now an open referral. If you need a doctor, that's who I smile to, versus my frustration on probably even a more mature AI-driven outcome, but it didn't hit the mark. So that at its core is where the combination of all your data coming in hits, and it's a person at the center, both a provider, a practitioner, as well as then the patient, and both of them need to have mutual agreement on what is the right care and what is the right outcome. And there's a mess of data that comes in. Because again, buried in my call center logs and my physician notes, I loved the ability to take something that's more administrative and just deal with it in 5 minutes and move on. And we're both better at going forward. So those are some of the stories. Same thing of however you're going to chase your data, and whether it's a clinical care gap closure or it's just better profiling, getting into SDOH, third-party data. They don't have an end game. They don't have that one source. They don't have there's no finish line. There's no project plan that says, hey, you are done. Hey, Justine, your organization now knows everything you need to know about social determinants or clinical, care gaps. You've got to have a solution and a data strategy that says, I'm always going to be able to willing to flex and to evolve, because every time I add a new patient, every time I add a new unstructured piece of data, what am I going to do with it? And that's at its core of where we're at. Again, and so I like that you always bring me back to the human at the center. That's why you do it. It's not just a KPI on a dashboard. It's not just a metric that says this was a throughput or an SLA. It's what are you trying to do to make that process more efficient, or that human, that patient, that member more engaged. And that's where you finally have better quality delivered.
Absolutely. And I think, Patrick, we've even said this off camera, we could sit down every few months and still have things to talk about with the way technology and data is advancing the industry. So I think this was another fantastic conversation. I'm sure I'll be calling you in a few months to sit down again.
No problem. I think the beauty of these is it's a reminder of, is your organization ready? Is your organization having some of these excitement ideas of, data makes users say, what else could I do? That's what we want with the data you have available. That's what you need with the data you have to go find. That's what you need with a platform or a mission like Inovalon to stitch it all together for you. So yeah, these are great, but this is what we want. We want people to not hide from it or wait until it's there, but rather embrace it and just say, hey, I heard you say you could do X. Could I now do that? Could I take sentiment as I handle a call? Justine smiles. Like, how do I translate that into you're engaged, you're happy? And that's the goal. So thank you very much.
Yeah, absolutely. Thanks for being here. And of course, to our audience, thank you for tuning in, and be sure to join us again next time.